Okay, so in this clip, we're just gonna discuss and think about the neurological system and what happens within different cultures, and what cultures might be a higher risk for things such as stroke, dementia, Alzheimer's disease, and things along those lines. So I don't really have a visual, because to me, I think it's pretty simple to just remember that African Americans, American Indians, Alaskan Natives, Asian Pacific Islanders, Hispanics, they all have a greater risk of these neurological diseases. So I just wanted to read some facts from the book here, that kind of just shows the risk that these cultures have. So African Americans, American Indians, Alaskan Natives, and Asian Pacific Islanders die from stroke at younger ages than whites do. And then we have, in the age group of 45 to 64 years of age, African Americans have 2 to 3 times the risk of stroke as whites. So not only are their risks higher, but their age groups are lower. So people are dying and developing these diseases in these different cultures younger and earlier than what whites are experiencing them. So the last fact that I just wanted to read from the book is that Hispanic and Asian men and women are much less likely to use emergency medical services to transport themselves to a hospital than their white counterparts. And Black women are less likely to use EMS than are white women. So again, not only do they have the increased risk of developing these neurological diseases, they also have the risk of developing them younger and dying from them younger than whites. And these cultures also are less likely to use EMTs or the ambulance to go to the hospital. And there is a difference with men and women as well, and that just kind of depends on what we're looking at, but it just shows that culture really plays a role in our neurological system and the things that happen. Come back for more.